We have all seen it in the movies. A man is arguing in a boardroom, his face turns red, he clutches his chest, groans in agony, and collapses to the floor. It is dramatic, it is sudden, and it is unmistakable. But here is the dangerous truth. Real heart attacks rarely look like that. In real life, a heart attack can be slow, it can be subtle, it can feel like the flu or a bad dinner or just a muscle pull. Cardiologists call these silent myocardial infarctions, and they are deadly precisely because they are quiet. People ignore them. They think, I'll just sleep it off, or I'll take an antacid. If you are over 40, your risk profile changes. Your blood vessels have had 4 decades to accumulate plaque. The margin for error gets smaller. In this video, we are going to learn the language of your heart. We will decode the signals that happen before the collapse. We will discuss the critical and often fatal differences between symptoms in men and women. And most importantly, I will tell you exactly what to do in the first 60 minutes, the golden hour that determines whether you survive. This is not just a health video. This is a survival guide. Let's begin. First, let's understand what is happening inside. A heart attack occurs when blood flow to a part of the heart muscle is blocked, usually by a clot. If that blockage is sudden and total, you get the Hollywood chest-crushing pain. But often, the blockage starts gradually, where the heart is struggling under stress. The heart doesn't have pain receptors on its surface like your skin does. It doesn't know how to say, ouch, my left ventricle hurts. So it hijacks your nervous system. It sends distress signals through the vagus nerve, which connects to your stomach, your jaw, your neck, and your arms. This is why heart pain often feels like it is happening everywhere else but the heart. This is called referred pain. Let's go through the 5 warning signs that people over 40 consistently ignore. We all get tired. You work hard, you have kids, you don't sleep enough. Being tired is normal, but there's a specific type of fatigue that precedes a heart attack. Patients describe it as bone-crushing or flu-like fatigue. How to tell the difference? If you run a mile, you should be tired. That is exertional fatigue. But if you walk to the mailbox and feel like you need to lie down for an hour, that is pathological fatigue. If you are suddenly exhausted doing a task that was easy for you last week, like making the bed or climbing 1 flight of stairs, that is a red flag. This happens because your heart is pumping harder to push blood through narrowed arteries. It is siphoning energy from the rest of your body just to keep beating. This is perhaps the most dangerous confusion. The bottom of your heart sits right on top of your stomach. When the heart is in distress, it can mimic the sensation of severe heartburn, acid reflux, or nausea. I have seen cases where people wake up at 2 a.m. with a burning sensation in their upper abdomen, they drink a glass of milk, take a Tums, and go to bed. They never wake up. The clue? Heart-related nausea often comes with a cold sweat. If you feel like you are going to throw up, but you also feel cold, clammy, and gray, that is not food poisoning. That is your heart struggling for oxygen. Also, if the burning moves up into your throat or jaw, pay attention. This is where the nervous system gets confused. Pain signals from the heart can get crossed with pain signals from the jaw, the teeth, the left shoulder, or the space between your shoulder blades. The dentist scenario. It sounds crazy, but people have gone to the dentist for a toothache only to be sent to the ER for a heart attack. The back scenario. Women in particular often feel a dull, heavy ache right between their shoulder blades. It feels like a pulled muscle, but massage doesn't help. The test. Movement. If you have a pulled back muscle, it usually hurts more when you twist your torso or press on it. Heart-related back pain usually doesn't change when you move your body. It is a constant, deep, nagging pressure that doesn't improve with position. This section is critical. Heart disease is the #1 killer of women, yet women are far more likely to be misdiagnosed in the ER than men. Men. Men typically experience the classic symptoms: crushing pressure in the center of the chest, like an elephant sitting on you, pain radiating down the left arm, shortness of breath. Women. Women's symptoms can be atypical. In fact, 43% of women having a heart attack experience no chest pain at all. Instead, women are more likely to experience extreme shortness of breath without chest pain, nausea and vomiting, dizziness or lightheadedness, back pain or jaw pain, an overwhelming sense of anxiety or impending doom. Ladies, listen to me. Because these symptoms are vague, doctors might dismiss them as anxiety or panic attacks. You must be your own advocate. If you feel wrong in a way you can't explain, insist on an EKG and a troponin blood test. Time is muscle. Every minute an artery is blocked, heart muscle dies. Permanent damage occurs rapidly. If you suspect you or someone else is having a heart attack, follow this survival protocol. Step 1, call 911, emergency services immediately. Do not drive yourself to the hospital. Do not let your spouse drive you. Why? Because paramedics can start treatment in the ambulance. They have defibrillators if your heart stops. If you pass out while driving, you become a missile. Step 2. Chew aspirin. While you wait, chew, not just swallow, 1 full-strength adult aspirin, 325 milligrams. Chewing it gets it into your bloodstream faster. Aspirin thins the blood and breaks up the platelets forming the clot. Now, do not do this if you are allergic to aspirin or if your doctor has told you otherwise. Step 3. Unlock the front door. This sounds practical, but it saves time. Unlock the door, then lie down near it. If you lose consciousness, the paramedics won't have to break the door down to get to you. Step 4. Stay calm. I know this is hard, but panic raises your heart rate and oxygen demand. Lie down, elevate your head slightly to make breathing easier, and try to slow your breathing. I don't want you to live in fear. I want you to live with awareness. Your body is an incredible machine, and it usually tries to warn you. If you are over 40, pay attention to the whispers. That shortness of breath on the stairs? Don't ignore it. That weird jaw pain that comes and goes? Get it checked. That sudden drop in energy? Talk to your doctor. The best way to survive a heart attack is to prevent it. Get your blood pressure checked, know your cholesterol numbers, walk every day. But if the moment comes, trust your gut. It is better to go to the ER and be told it's just heartburn than to stay home and never wake up. Please share this video. Send it to your parents, your spouse, your friends. Recognizing these signs could literally save a life tomorrow. If you found this valuable, please subscribe. We are building a community of people who refuse to let age dictate their health. I'll see you in the next video. Stay safe.